So this is a pre-tension load to the tissues in the back part of the hip. First thing you're going to do is perch near the edge of a seat. Second thing you're going to do is you're going to cross your leg into this figure 4 position. So this is the leg that I'm trying to tension. First thing you want to do is you want to make sure that you're sitting up nice and tall, and you're going to do an anterior pelvic tilt. Anterior pelvic tilt, if you can imagine your pelvis being a pitcher of water and you're trying to dump the water out in front of you. So you're going to rotate your pelvis forward, and it's going to feel like you're sitting a little bit more on your sit bones and your back is slightly curving a little bit more. You're going to hold this position throughout the duration of this drill. From there, what you're going to do is you're going to lean your body slightly forward until you feel tension generated in the back hip area. From there, first thing you're going to do is you're going to bring the knee up or bring the knee down and trying to hold the position that has the most tension in the back stuff. I feel more tension when I bring that knee up slightly, so I'm going to hold that position. Next thing you're going to do is you're going to rotate your trunk. You're going to rotate your trunk away from the knee that's resting or rotate towards the knee. And you're going to hold the direction or the position where you feel more tension. So I feel it more in this position, I'm going to hold that. Then I'm going to side bend my shoulder, so side bend my body, so I'm bringing my shoulder down towards my hip, same side hip, or going the opposite way, so bringing the opposite shoulder towards the same side hip and trying to see where I feel more tension. I actually feel more tension when I'm side bending this way, so I'm going to hold that. The last move you're going to do is to actually shift and shear my thigh forward. And it's a very small motion, but you're going to feel more tension build up and generate in the tissue that you're trying to target. And you're going to hold that position, and then you're going to undo. I'll show you from a different position, but I want you to understand that you're going to hold that position for a second or two, then back off, and then you're going to go back into it a little bit more, trying to go a little bit further than the previous attempt, and hold that, and then let it go. And then one more time, you're going to shear and shift your whole thigh forward and hold that position. So let me show you from a side angle. So if you're trying to shear this knee forward, what you're going to do is you're going to shear it and shift it forward. So notice how my pelvis is kind of shifting and moving. That's actually moving this bone that direction, or forward or anteriorly is what we like to call it. So it's a very subtle motion, but you can feel a lot of difference in the target tissue that you're trying to hit.